Hey everybody, it's Dr. Gerstmar from Aspire Natural Health. Interesting one today, a little bit different for me. So, as you know, or you may know, my area of expertise is in gut dysfunction and function, autoimmune disease, and other hard to treat cases. So it's that latter category, those hard to treat cases, that bring in a lot of really interesting things for me. So a dive into something I haven't dealt much with before, and frankly, people don't talk much about, and that's vaginal pain or vulvar pain, right? So something for the ladies. As men, we tend to get a lot of attention with our little blue pills, but the ladies just don't get that much attention. So this particular syndrome has a number of names. It can be called vulvodynia, or is the most common one. Vulvar vestibulitis is another, or dyspareunia, which means painful intercourse. So this is anything where there's pain with penetration or pain with intercourse. Now, there can be a number of reasons for this, ranging from endometriosis to tight pelvic floor muscles, vaginal thinning. So if a woman is menopausal, postmenopausal, that drop in estrogen levels can cause the tissues of the vagina to become very thin and fragile, and then anything that puts any pressure on them can tear the vagina. Also, those low estrogen levels can cause a lack of lubrication, and so that dryness again can make things uncomfortable for women. So if you're having any of these issues with painful intercourse or painful penetration, and you're menopausal or postmenopausal, the issue might be estrogen levels which are just too low. Now, there are things we can do globally, getting healthy, tending to the adrenals, which can naturally bring up those estrogen levels. But for some women, the answer is simply a little bit of low-dose estrogen cream that's applied vaginally anywhere from daily to, once or twice a week can make a huge world of difference in restoring good tone and texture to those vaginal tissues, making them much less sensitive, much stronger, and increasing lubrication can make intercourse a much more pleasurable thing for a woman. Now, what brought me onto this new topic is a patient who's had vulvar vestibulitis or this pain ever since being on birth control pills. And we've explored a few different topics, looking at things like overly tight pelvic floor muscles. Those are the muscles in and around the vagina. They can go into spasm, and they can cause pain themselves and inability to relax, for one thing. But this really seemed to be more. And to their credit, this patient dug up some very interesting studies. That's what I'm here to share with you today, about how being on the pill can actually lead to testosterone deficiencies. So when we think of testosterone, we typically think of guys. And of course, men normally should have a lot more testosterone than women do. When women have too much testosterone, it can lead to things like PCOS or polycystic ovarian syndrome, and other problems for women. But we don't often think of, and we should, testosterone deficiency for women. So in a nutshell, what happens is the pill comes in and turns off your ovaries. And supplies some of those hormones back to you. So by turning off the ovaries, of course, it turns off ovulation. You don't release any eggs, and you can't get pregnant. So that's how the pill stops pregnancy. Now, the pill sometimes is also used to try and correct hormone levels, and that can sometimes work well and sometimes work very poorly. So the pill turns off your ovaries, and then the pill supplies estrogen and a progesterone-like substance called progestins, and that can be a topic for a whole other vlog on another day. But there's another hormone that the pill doesn't supply that your ovaries also make in addition to estrogen and progesterone, and that's testosterone. So for some women, why the tremendous decline in libido when they go on the pill? It can be because their testosterone tanks. But we're also finding, and again, I've linked to the studies here for you, and thanks to this patient who brought this up for me, what we find is that the vagina has a lot of androgen receptors. Androgen essentially is just another word for testosterone. So while we've mentioned before that low estrogen levels can cause thinning of the vaginal tissues, and that can lead to problems, What we've also found is that the vagina has these testosterone receptors as well, and the lack of testosterone can cause issues. Now, one small study that was done found that using a combination estrogen and testosterone cream, and again, these need to be put together by a compounding pharmacy, so you can't go down to your local pharmacy and get it. You have to have the doctor write the prescription to a compounding pharmacy. But this application of this cream resulted in a big restoration of health to the vaginal tissues and a tremendous reduction in the pain score that these women have. So this particular patient who turned me on to this has found that in just 1 week, one simple week of using this estrogen testosterone cream, she's seeing tremendous positive changes. We're both extremely hopeful for her that this will make a huge difference. Now, obviously, our goal is to eventually restore normal hormonal function so this patient doesn't have to take this cream for the rest of her life. But the bottom line is this: a simple and inexpensive cream may be the answer to what has been a 2+ year problem for this patient. So ladies, if you're out there, or men, if you're listening and you know this is an issue, please bring this up, right? I've listed some of the resources, which are some studies and some articles about this, but it could be as simple as a testosterone and or estrogen cream, and you may be suffering from a testosterone deficiency. I hope this is helpful. Please take this to your doctors, get some help. If no one else will help you, give us a call, contact us. We'll be happy to help. Okay? Aspire Natural Health, that's ASPIRE, aspirenaturalhealth.com, and facebook.com, Aspire Natural Health. Great ways to get in touch with us and keep up to date with what we're doing. Until we talk again, take care.